So I'm going to talk about suicidal risk assessment. So what are the questions I'm going to ask and think and explore, like risk to self, then previous self-harm or suicidal attempts. Then I'm going to also explore about the psychosocial history, like history of trauma, very important to explore. Then perceived lack of social support, any recent stressful events, sense of entrapment, hopelessness, ambivalence of life, low perceived self-worth, then impulsive tendencies, poor insight, coping resources, willingness to receive help, engage to services. The other things that needs to be explored as well: access to means, history of mental physical illness, then drug alcohol use, family history of suicide, mental illness, drug alcohol use. Then what are the protective factors? Very important to discuss about the protective factors, like perceived good social support, then dependence, pets, children, valued occupations, passions, sense of purpose, contribution, religious faith, then good insight and coping resources, optimism, hope for the future. Let's discuss about the risk to others, like dependence, history of violence, psychosis, overvalued ideas, delusions, hallucinations, access to weapons. Then occupational risk, like lorry driver, healthcare provider, pilot. And risk from others, like such as domestic violence. Do you feel safe at home? Now, it is also important to discuss about the nature of suicidal ideation, like the thought content, then intent. What did you actually want to happen? Frequency, intensity, intrusiveness, persistence of thoughts, planning and preparation undertaken, like seeking isolation, access to means, research into methods, writing a note, putting things into place, like putting affairs into order. What I need to explore if an attempt has already been made, like patterns of events, precipitating factors, state of mind at that time, concurrent use of alcohol, drugs, perception of lethality method. What was the intent? How did help arrive? State of mind now. Are you angry? Are you regretful that it did not work, that they made the attempt? Ashamed, ambivalent, grateful. Assessment of ongoing thoughts and plans. So obviously the next is to have a proper planning in place so that you get enough support and don't attempt to have a suicide. And obviously safety netting will be done, follow-up will be done, documentation will be written.